This is a short presentation on the overuse conditions of the elbow and wrist. It includes carpal tunnel syndrome and tendinosis and tendinitis. First, we will look at tendinosis and tendinitis. We will focus on 3 disorders. One is de Quervain's tenosynovitis. Another is lateral epicondylitis, also known as tennis elbow. And medial epicondylitis, also known as golfer's elbow. First, we will look at de Quervain's tenosynovitis. De Quervain syndrome is caused by repetitive overuse or hyperextension of the extensor pollicis brevis and adductor pollicis longus tendons of the first compartment of the wrist extensors. Frequent twisting, grasping, clenching, pinching, or wringing can irritate the synovum and sheath, causing swelling and inflammation. This can often happen among new mothers holding their infants' heads, knitters, and people who are playing sports with rackets. To evaluate a client who may have de Quervain's tenosynovitis, you would perform the Finkelstein test. First, you would have the client place their thumb in a closed fist, then tilt the hand down. If pain is felt during the test, it is a positive indicator of de Quervain syndrome. The intervention for de Quervain's tenosynovitis is to teach patients to avoid wrist deviation, especially in conjunction with pinching. You can also provide built-up handles for the client. If splinting, use a forearm-based thumb spica, leaving the IP joint free. Watch for irritation from the radial splint edge along the first dorsal compartment for intervention. Now we will look at lateral epicondylitis, also known as tennis elbow. Lateral epicondylitis involves the extrinsic extensors at their origin, the lateral epicondyle and the extensor wad, which is the proximal portion of the extensor muscles. The 3 most common tests for evaluation is the Cozen's test, the Mills test, and the Maudsley test. Here is a visual of the Cozen's test. For the Cozen's test, the patient's elbow is stabilized by the examiner's thumb, which rests on the patient's lateral epicondyle. The patient is then asked to make a fist, pronate the forearm, and radially deviate and extend the wrist while the examiner resists the motion. A positive sign is indicated by sudden severe pain in the area of the lateral epicondyle of the humerus. Here is a visual of the Maudsley test. The Maudsley test has the examiner resist extension of the third digit of the hand, stressing the extensor digitorum muscle and tendon. A positive test is indicated by pain over the lateral epicondyle of the humerus. Here is a visual of the Mills test. For the Mills test, while palpating the lateral epicondyle, the examiner pronates the patient's forearm and flexes the wrist fully and extends the elbow. A positive test is indicated by pain over the lateral epicondyle of the humerus. For intervention for lateral epicondylitis, exercises should include proximal conditioning and scapular stabilizing. The OT should also instruct the client to use built-up handles, and if using orthosis, support the wrist and extension, especially at night. Splinted wrist position should range from neutral to 30 degrees. Also, a A counterforce strap, which is a strap placed over the extensor wad, can be used to reduce the load on the tendon during the day with activity. Here is a picture of the counterforce strap. The rest of this video on common disorders of the elbow and wrist will be completed at a later time.